All right, we have our large intestines, our colon, that sometimes people will call. So when we look at the large intestines as a whole, we've got the right side here. This is the cecum. This is where the appendix is, this little purple pipe cleaner here. The cecum, which has an attachment to the small intestine. We've got the ascending colon, transverse colon, descending colon, that then comes down into the sigmoid and then the rectum. And so we're looking at the large intestine here in Betty. And so when we looking at the anatomy of the large intestine, there's actually a ligament that connects the curve from the ascending colon to the transverse colon on this right side, and then there's another ligament that supports the colon from the transverse colon to the descending colon on this side. So those are two common areas we will try to release with our hands if there's tension within that ligament system. We're also very interested, as we're working with patients, on the cecum here. So this beginning of the large intestine here, it sits right on this inner hip here, and not only does the appendix cause issue and inflammation and tension, whether you have one or especially if you've had it removed, that's one area that can create a lot of tension in this hip. You've got the hip flexor muscle come under here. There's also ligaments on the back side of the cecum that help support that area of the intestine. And then another area that's really interesting on this right side is there is actually a ligament from the right ovary to the cecum in a percentage of people. And so what we will find clinically is a female patient, a patient going through puberty and having their period for the first time, can start to have tension around the ovary and around that ligament that connects to the cecum. It could be related to the ovary. It could also be a history of inflammation in the cecum, in this part of the intestine, maybe from antibiotics, appendix being removed. Those are probably some of the most common ones. But what that ligament, the ligament of Clayette, can do is it can start to refer pain into the right knee. And so if someone presents with right knee pain that started around puberty, we're thinking in our head, I wonder if this patient has this ligament. I'm going to check it. I'm going to see if maybe they have an issue in that area to help free up that movement of everything that then travels down into the pelvis and into the knee. So that's an interesting area of treatment for patients. And then we come down to the sigmoid here on this left side, and we've got a lot of layers, the mesocolon, a lot of layers that attach that support that part of the colon. And so these are, again, the areas that we're working with our hands a lot, especially as they come down into the rectum. And one of the things I like to really mention is people who struggle with constipation. A lot of times it depends on where the constipation sits, right? So sometimes people can be really constipated at the cecum. That can actually be one of the #1 drivers, is an issue here. But you could have stool backed up anywhere along this pathway. And so we have a lot of conversations with active individuals who will have back pain or throw their back out, maybe because they're really pushing their performance, doing their 1 rep max squat or doing a race on a day that they haven't had a bowel movement. And so if this gets backed up anywhere, it can affect the spine, because you can see where the spine is here. But a lot of times we see issues when there's a backup down in this sigmoid area. It can start to throw off the pelvis alignment, and so that's that like throwing out your back, feeling a pop potentially, and your pelvis being not level. So that's a really common one when we look at the sigmoid. Another really interesting thing when we look at the large intestine is there's a tissue called the greater omentum that drops down, that attaches to the transverse colon here, and then folds and then attaches to the bottom of the stomach, but it also just lays over a majority of the abdominal wall, kind of belly button, and then down over the small intestine tubes. So this greater omentum tissue is a big piece of our immune system. It's actually got lymphatic, adipose tissue, vascularity. There's a lot going on in there, but it's part of our immune system. And if we have something inflamed in our body, it will kind of migrate around and travel to different areas of the body as it's trying to heal. It's trying to help heal the body. We learned in class one time that one of the cadavers actually had it up near the heart. This person had passed away from a heart attack. So it's a really impressive tissue. And so oftentimes if there's, let's say, a C-section scar and the greater omentum's really kind of gathered around that area trying to heal, also we have to work that tissue to help normalize that movement and allow it to spread out and be able to move again to other areas of the body. So the greater omentum's a really powerful spot. And then we talk about the cannonball area quite a bit here because it's a good self-care spot for us to do skin rolling and help with blood flow and calming the nerves. And that's actually this chunk here on the left side of the large intestine. So now you can kind of see why we skin roll over that area. This is just where a lot of the blood vessels to the gut, the intestines, come together. It's where the vagus nerve comes down and meets with the sacral plexus. So it's a really good sweet spot when we look at just improving function in that area. So looking at treatment with the large intestine, oftentimes what we're doing is we're coming in kind of from the side. We're trying to make sure there's lateral mobility, medial mobility, that it's not adhered to the backside. Anatomically, the ascending colon on the right side sits forward a little bit more. The descending colon's a little bit further back, so we do have to get a little bit deeper in there to work that area. And then the transverse colon we can work with someone laying down. Oftentimes we'll do a seated position because gravity really helps to engage that tissue. And then again, we work these ligaments on right and left side, having them seated and kind of working this upper area here. And then we come down to the sigmoid. We work that with the pelvis, same thing with the sigmoid, taking the hip in different directions just because of how closely related those areas are to the hip function and the hip muscles, and really just trying to, when we move our hip here, the ascending colon needs to also be able to move. And then when we bring our hip back, when we're walking or lunging or running, the colon also needs to be able to be mobile. So oftentimes we will take the intestine and make sure it moves as the hip is going through various ranges of motion. And a lot of that depends as well how if there was a mechanism of injury, if someone was, let's say they were sitting cross-legged in a car and they were T-boned, not driving. And maybe there's this colon tension held in this cross-legged position. And so that's just a good example to kind of show how that ties in. So lots of stuff with the colon, lots of stuff with the large intestine. This is why we want this area to be moving. It really spans a large, diaphragm to pelvic floor. And so a lot of potential for dysfunction, especially the spine, but a lot of different ways that we can help it move and help people feel better. And then the last thing here that we see often is because of the location right on the torso here on the right and the left, if someone has, let's say, a postural tension where they are always leaning to this side, makes me think of you know, if you're writing with your hand with a pencil in school and you're leaning on one side. So oftentimes we will have this habitual scoliosis or postural position, and so that can actually stress the intestine because it compresses the space between the rib and the pelvis. And so once we get the intestine moving better, this is why we're talking about torso waist mobility, getting the muscles to adapt again to that new space, get the core muscles to work again, get the shoulders to get involved as well. So that's another common thing we'll see with large intestine tension here, is just that one-sided here. So hopefully that helps you have a better understanding of the large intestine, and we'll see you next time for the next organ spotlight.